Let's touch on cognitive behavioral therapy. If there's aspects, that you find helpful or, if you encourage it or just kind of want to touch on it a little bit for people that may
Sure.
not know what it is.
Absolutely. So cognitive behavioral therapy, I think can be really helpful for all of the reasons you mentioned. Learning triggers and kind of increasing self-awareness about thoughts and feelings that are happening in the moment and what was happening before, and then what happened as a result of that. And then coming up with different strategies to um, either avoid some of the triggers or change your response to the triggers. Because sometimes you can avoid triggers, it's kind of part of life. So it's really good at teaching relaxation strategies to get through tough moments if you've got to face a trigger, thinking skills to change how we respond to stressors in the moment. And then kind of acknowledging the feelings in there too. And like I mentioned a little bit earlier, with the self-compassion piece, again, like um, not necessarily pushing them down, letting them still be there and just responding to them in a more adaptive way. I think finding a CBT therapist can be hard because a lot of you know, web searches and directories out there, you'll have a therapist who has expertise, so they say, in like 17 different things. And that's not really possible. So it can be kind of misleading in that way. And I think especially for CVS, like you mentioned, sleep and medication adherence too, especially for teens who are wanting some control, but are also so burned out by having this illness for so long by that point. I think having a CBT trained health psychologist would be even more helpful. Um, Again, harder to find, but they are specifically trained to help um, kids with chronic illnesses from a CBT perspective.